What is gingivitis and what can I do for it? A lot of us have had those bleeding gums, that buildup of plaque and bacteria that can lead to infection and inflammation and irritation and bleeding in the gums, which is gingivitis. But what can we do for it? Well, long story short, for those of you that don't care about the details of the trial we're going to talk about, vitamin D may show some promise for reducing the symptoms of gingivitis, and in a dose-dependent manner, meaning if you have a little bit more, it will reduce the symptoms even faster than having less, right? And 2,000 IU was the most they had in the trial, reduced symptoms in 30 days, okay? Aside from vitamin D, we have a mouthwash containing elderberry, maybe something that can help to reduce the risk for developing gingivitis in the first place. So it serves as a good preventative measure, apparently. Using a toothpaste that has extra virgin olive oil, betaine, and xylitol. Betaine is what we find commonly referred to as trimethylglycine in beetroot, right? Among other things like wheat germ and other foods. Okay? So a toothpaste that contains those apparently can help to improve the symptoms of gingivitis. Chewing gum that has sugar alcohols, interestingly, and we're not huge here on sugar alcohols and wellness, although there are greater evils, and at least they shouldn't spike your insulin, albeit maybe potentially could reduce insulin sensitivity over time. That is a debate, though. May be able to reduce inflammation associated with gingivitis. That wouldn't be my first recommendation, though, right? I would definitely rather go with at least probably that toothpaste, EVO, and betaine, or at least great ingredients. And try the mouthwash with elderberry first and foremost to prevent it in the first place. And just keep good oral hygiene. That's your best bet for preventing gingivitis, right? Preventing that buildup of plaque and bacteria and increasing your risk for infection of the gums, right? So what else do we have? Probiotics. Probiotics may be useful for reducing the symptoms of gingivitis, albeit we need a little bit more research to show that that's absolutely the fact. Albeit probiotics are good for many other things, probably can't hurt to have them anyway. Right? So last but not least, a neem gel or a other sort of gel. What was it? Hydrochloric gel. It was something like that. It was a name like that. But a neem gel, right? That is good for reducing inflammation, the buildup of plaque and bacteria that's associated with gingivitis, right? So those are a few natural things that we can do. As far as the study summaries on Examine Go, where they summarize studies. Examine.com is an unbiased website that deals with natural supplementation and nutrition and natural remedies for things, right? They don't have any funding from sponsors. They don't do advertisements. All of their money comes from membership, which I am one of their members, proudly. So that's where I got that information, if you were curious. But, these are based on randomized controlled trials and meta-analyses and things of that nature. So some pretty solid research behind them. Now, as for the trial, if you want to hear about it, if you're somebody that's interested in the details of this very recent trial that came out involving 96 people, randomized controlled trial, where they provided anywhere from 500 to 2,000 IU of vitamin D to people that were not, keyword not, deficient in vitamin D. They had levels from 20 to 60 nanograms per deciliter, 20 to 50 nanograms per deciliter are normal levels of vitamin D, and less than 12 nanograms per deciliter would characterize a deficiency in vitamin D. And of course, certain demographics are more likely to be deficient, like African Americans. It takes more sunlight to produce the same amount of vitamin D than it would in somebody with, say, fairer skin, right? So there are caveats to that. However, in this trial, they provided these different amounts of vitamin D daily to this 96 people over the course of 3 months. And they measured the severity of their gingivitis via a gingivitis index, okay? Now, the results showed, interestingly, the group that had 500 IU of vitamin D a day had reduction in their symptoms of gingivitis after 90 days. The group that had 1,000 IU of vitamin D per day, a reduction in symptoms at 60 days. The group that had 2,000 IU of vitamin D had a reduction in symptoms as fast as, you guessed it, 30 days, 1 month, right? So pretty much for every 500 or 1,000 IU of vitamin D, we went down 30 days in terms of how long it took for the symptoms of gingivitis to be reduced. And Vitamin D is good for us anyway, right? A lot of us are deficient in vitamin D, or even if we're not, a little bit more can't hurt because we don't get enough sunlight. You know, evolutionarily, we were out getting so much more sun. We were outside, we were in tune with nature, we were getting fresh air, and we were in, we were grounding more often. You know, the constant flow of negative potential from the air, stimulating the parasympathetic nervous system and reducing inflammation, and just being healthy and being outside is a natural thing. Right? And so it doesn't hurt to have a little bit more vitamin D, typically, and it's most heralded for probably bone health and immunity, but also plays a major role in the health of your hair and skin and teeth and hormone production and mood and things of that nature, right? So vitamin D, important anyway. Now, if you're going to take more, and especially if you're going to take very high doses, now to equate to micrograms with that 2,000 IU it was 50 micrograms. The way you convert from IU to micrograms of vitamin D, and this is different for all vitamins, but for vitamin D specifically, would be divide it by 4, take off a 0. Easiest way to do it, I think, right? So 2,550, boom, right? So that's what we got for you guys, you know? I think everybody should pretty much be taking vitamin D. Omega-3s, if you don't eat a lot of fish, especially things like probiotics, something meant to say hurt, something like curcumin can't hurt. We lost you there for a second because we're low battery. But we'll go through a day where we just talk about all the supplements that I take, all the things I think people should generally have, and especially if someone is deficient stuff. Hope you guys had a great day today. Happy Saturday. I had a great time. I partied with my nephew. He's 3 now. So, Holly, appreciate that. Chris Logan Biggs. Donnelly, how you doing? I mirror you, Lopez Debbie. Amos Lopez. Hey ya, Das 4371, what's up? I mirror you. Josh, appreciate that. How you doing? We have fun on here, man. Holly. And the first one of the day, Joshy Joe, my man. And Mishka or Misha, and you're on. Hope I didn't pronounce it incorrectly. I took 2 shots, so this way one of them was right. Hope you had a fantastic day today. Thank you so much. Thanks for supporting When Wellness. This one's for you guys. And go do something great for yourself. That's what it's all about. It's giving you the tools to naturally, independently improve your overall health and your life. So we hope that these videos at least can help to do that. It help you to do that, I should say, in some way. You guys have an absolutely fantastic rest of your day. It's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thanks so much, and happy When Wellness. Good night.